Steve, thanks for being here. We often record conversations and interviews with people. Sometimes it's about the training, sometimes about their health issues, sometimes it's about how they apply it in their own practice. And one thing I really liked hearing from you, which I thought would be great to talk about today, is that you often mentioned, well, what we do in the field of quantum biology, what I learned during the training, it works great for your patients in the physio practice, but I also notice it a lot at home, and I thought it'd be nice to talk about that. Can you tell us what it does in your family life and how you apply it?
Yeah, that was quite a big change. And I have to say, it didn't all happen at once.
No.
But we're still implementing small, incremental little pieces. And yeah, especially the oldest one. My oldest is 6. And for him, it is all quite a bit more difficult. The 3-year-old, when I started the training, he was actually just 2. That's all a bit easier to get them involved in. But the oldest, well, he wasn't used to heading directly outdoors into the fresh air in the morning right after climbing out of his warm bed. Or he wasn't used to, maybe skipping his usual morning sandwich for breakfast for a change.
Yeah.
And those are small, useful tools that we apply. And yeah, that after dinner, if we watch TV, that's allowed, but only with special glasses on. Those are small things. Yeah, they did take some time.
Yeah, I can definitely imagine at that age with young kids.
Yeah, definitely.
And furthermore, beyond that, aside from the fact that it can seem like an incredibly demanding task for the parents, which I certainly won't deny, what has that done, in your view, for the children and your family?
I think that it's hard for the kids to see the benefits at this moment. That will come later in life. And that's why I think it's important to do it now, to get them involved in it already, even if only partially, so that it just becomes their lifestyle too. And what I see it brings me and what it brings them is lots of energy, being high energy, falling asleep very easily, sleeping through the night, getting out of bed and wanting to play, run, and jump right away. Very important. And if I compare it to school, for example, seeing how often kids are absent due to common colds or the flu or something else entirely. And I'd be lying if I said they never have a runny nose, but I feel like they're just robust. The last time I had to keep them home is really a very long time ago. And yeah, I attribute that 100% to the lifestyle we have at home.
Yeah, that's obviously great to hear. And especially about that sleep part. Could you tell us a bit more about that? Because most people, we have here, of course, many people in the practice say, well, I can't get my kids to sleep. It's a disaster. I have to read for an hour. Can you tell us something about what you specifically integrate regarding sleep, which gives you a high probability that the kids sleep well and fall asleep easily?
Yes, definitely. We all eat together. We eat dinner then. Well, during this particular time of the year, it's still light out, but as soon as the sun begins to set, basically, we actually never have the lights on. But if they are on, like the red light or something similar, it goes off and we switch to much softer ambient lighting or candlelight. After that, we play a game. We do something with the kids. We all play together, which helps them start to wind down a bit more. But we mainly avoid blue light, and we can do that by using glasses. We can have the kids wear glasses, so they're actually filtering out the blue light. And what that basically does is ensure they don't stay in that active mode. Yeah, we really work towards bedtime, and that sounds very strange. Perhaps it might sound a bit exaggerated to say work, but it's simply a way of life. It's just how things go at our place. And then after that, the kids go and get changed very quietly, read for a little bit, and then they finally go to bed. And I don't think that significant transition happens all at once or right away in the first week. But if you continue to maintain that routine for a number of weeks and do it consistently, they get used to it in a very short amount of time and you really notice the benefits right away.
Yes, and regarding those benefits, it's mainly sleeping through the night and then being truly rested.
That and falling asleep. It really never happens that I have to go back upstairs because he's screaming that he can't sleep. Sometimes I don't even believe it. So I'll stand by the door and then really within maybe 2 minutes, he's already snoring. So that's really wonderful.
Yes, and that applies to both of them.
That definitely applies to both.
Because it's often said, well, if a child is very young, they can't sleep through the night or it hardly ever happens.
Okay, well, that's not what I'm seeing. No, that's not what I'm seeing. And it is true that the youngest sometimes wakes up a little bit earlier. So and really not at 6 o'clock, but well, let's just say 6:30. Then he finally comes out. But I think for that age, for a 3-year-old, that's already quite something, especially if they actually go to bed at 7:30.
Yes, definitely. Another thing I often hear, we have a children's guide and a child counselor. We have many programs. We even have a specialist in the practice who actually guides the kids. And another thing you hear is it's impossible, or well, impossible. It's very difficult to get them to eat healthily because they just always want sweets. How do you handle that at home?
I'm not saying it's always easy. Certainly not, because, well, they're also at school. Things are handed out in class. They try things,
Yes, of course.
but I do think you can make conscious choices and look at what is highly processed and what is at least minimally or less processed. And yeah, I always think it's a great example when recently I was at football with the oldest, and a friend of mine says, "Do you want something to drink?" So he says, "Well, just water," which is already something. Usually it's, well, cola, apple juice, you name it. And he says, "Do you want a bag of Haribo?" And then he looked at me, "Daddy, what is that?" And then I thought, okay, fine, right. Yeah, I just make them very happy with a piece of chocolate, and you can make choices there too, right? You can give milk a chocolate, but you can also give them 85 or 90% dark chocolate. So it's not that they don't have treats, but I think you can make conscious choices in that, and that is exactly what we do.
Yes, exactly. And can you tell us something about what the basis of their diet is? Because, for example, well, fresh vegetables and fruits for children are even more essential than for adults. How do you handle that at home?
Yeah, mostly looking at the seasonal vegetables, seasonal fruit. So that means in the winter months, basically little to none, and they actually do really well on that. I haven't, yeah, in those few years, I haven't really noticed anything where I think, oh yeah, that's because they don't eat fruit. And that was always part of my upbringing. You have to eat that apple and you have to eat that pear for your vitamin C, right? Like that canker sore in your mouth. That's because you've eaten far too little fruit. So yeah, those are things, yeah, I just don't see that with them. So the basis is protein and fat. And the hardest part is maintaining that, I think, with those kids. They always want to go off track a little bit sometimes. And yeah, then we choose a sourdough roll, and that, yeah, we do that sometimes too.
Sure, yeah, of course. Can you tell us something about meal frequencies? Right. I quite often hear clients who come to us saying they have it in their heads that the child must eat 8 times a day because they're growing. So you can't not give a child food. How do you do that at home?
Yeah, easy. Breakfast first, then he takes food to school. That's the hard part, because what happens with it there, we don't entirely know. Then at the middle of the day, he usually eats his lunch at school, and then he comes back home, and then it depends quite a bit on the day. If he doesn't ask for anything, fine. And if he does want something, well, then we sometimes look for some broth or something else, and then we all eat together. So no, I think more than 4 or 5 times we don't reach.
No. So you're not constantly busy eating 8 different times a day and constant snacking.
No, I do try to make sure he eats enough in the morning so that he doesn't ask for more. I leave it up to him then. It's not like, oh, you only get that. No, if he wants more, he can certainly have it. So I make sure that he is at least well satiated in the morning.
Yeah, great. And well, we've talked a lot about the kids, and you live that lifestyle yourself. How is it for your wife?
More of an adjustment than for me. But she responds very well to explanations, and that's also nice. And you don't always have that knowledge ready, but then you look it up again and you talk about it together. I think, yeah, setting hard demands doesn't make much sense. I think more like, okay, explain it. Why is it? And then she eventually starts thinking about it herself and goes along with it. So that, no, she grows with it, but she's always just a step behind.
Yes, and in relation to her vision and health, how does she see that regarding the children?
No, there. Yeah, she's 100% in agreement, especially since she also sees, yeah, ultimately you live for them. At the very least, they are the most important things to me. And yeah, that is true. So they should get the very best. And yeah, especially with the depth of knowledge, the extensive background information, and seeing exactly how they are performing. Yeah, that's it. That ensures that she just goes along with it.
Yeah, she's completely on board.
Yeah, absolutely.
Why I'm asking, because you sometimes hear that. Sometimes a client or a child comes in with a condition and we adjust that lifestyle. But then you also have the other side of the family who sometimes feels like, I didn't do that training myself and I have no complaints, so why should I go along with this? But you clearly have a sense that she really sees what it does for the kids.
Absolutely.
Yeah, that is.
Yeah, those are just small examples. But when he especially with the youngest. He suffered a lot from eczema on his back, lots of dry patches under his little armpits.
And how old was he when he suffered from that?
1 year old.
One.
Yeah. And then, yeah, then you seek help and you start looking. And of course, I knew at that point, okay, we can try other things. Still, the advice you get is, okay, keep it greasy. Try this, try that, try the other. Did that for a while. It just doesn't work. And eventually you change your lifestyle. You make sure that skin gets much more contact with the sun by making sure you consume a wide variety of healthy foods, focusing on your daily rhythm, getting enough sleep, and prioritizing recovery. He no longer has any health issues to deal with.
No, that's cool to hear. Good to hear. And how long did it take before that started to clear up?
Yeah, that took a little while, especially during the winter months. It's much more challenging because the window is quite different.
Keeping a rhythm is harder in the winter.
Yeah, I absolutely agree with that. But I think in the warmer summer months, it usually took at most 4 or 5 months before it was gone. Don't hold me to that. I don't know exactly.
And he's 3 now? And has it ever come back since it cleared up?
No. Yeah, actually, it's not just our lifestyle that is adjusted, but we adjust everything now. We used to go on vacation every year in the summer.
Yeah.
And I think, why go on vacation when the weather is nice here? So we go on vacation outside the holidays to keep vitamin D high, among other things. And to let that skin come into contact with the sun, yeah, works super well. It really hasn't come back.
Great, man. That is really cool. Thanks for sharing about the kids and the family. I honestly believe it is incredibly valuable because more and more people want to implement it on a large scale in Zao. And as you know, kids can be quite a challenge.
It certainly is and remains so, I think.
Yeah, it is. Definitely. But I still think, and you're confirming it again, that it's just doable and that it yields a lot of value. And that's obviously the most important thing, that it really helps the children instead of just thinking that it brings restrictions, because that's often the image we have. I'm not going to impose anything on a young child. He should just eat whatever he wants and drink whatever he wants. While we certainly agree that guiding them a bit in that wouldn't hurt, from our own professional perspective,
it is very important. No, it certainly cannot hurt. And also just very important, I think, not just that they do it, but also that they grow with it and that they develop their own personal vision regarding health. And then, well, preferably in this direction.
Yeah, thanks for sharing that with us.
Yeah, you're welcome.